Welcome to another episode of Chill with Bill at San Antonio Zoo. Today I have with me Dr. Tom Gowan, and he is the chair of the Pediatric Department at Baptist Children's Hospital at North Central. And today we're at one of my favorite habitats. It's the giraffes. Did you know, Dr. Gowan, that a giraffe has the same number of bones in its neck that we do?
That's incredible.
Today we're going to talk about a serious subject, and that is RSV. So first off, Dr. Gowan, what is RSV?
Respiratory syncytial virus. It's a virus that's associated usually with winter times.
Dr. Gowan, if you have a child that is sick, what do we do about treating them?
Well, the sickness with RSV in young children can be a child that's very irritable, a child that's sleeping more, a child that refuses to eat, decrease urine output, or has work of breathing where they're breathing really fast and you see their lungs. A young child should never look like a bodybuilder with definition in the chest. If they do, that's what we call retractions. And you can see your pediatrician, or you feel it's urgent, is come to the emergency room. A lot of things we do is measure their oxygen, provide oxygen supplementation if it's necessary. We have a special kind of way of delivering pressure, a high flow nasal cannula that'll open the airways and keep them from collapsing that we use. And it's really been a remarkable way of treating children with bronchiolitis. Many years ago, the very sick children were often intubated and put on a ventilator. But now with high flow nasal cannula, it's less invasive and we actually have better outcomes with it.
Dr. Gowan, what should a parent look for if they think their child has RSV?
Well, if we look at age-related, those young babies under 6 months, if they're refusing to eat, decrease urine output, if they're have a work of breathing to where their ribs are showing, those are children that are at risk and are definitely having respiratory problems. Lots of copious secretions from the nose. Those babies that are under 3 months are what we call obligate nose breathers. They have to have their nose to breathe and to eat. So keeping them cleaned out from their nose, and if they're constantly obstructed, they'll have trouble sleeping, they'll have trouble eating, and that's probably time to see your pediatrician, or if you're really worried, come to the emergency room and get seen.
Dr. Gowan, what would you do if one of the giraffes got RSV?
Well, they're pretty long-winded, so I'm not sure what I would do.
Dr. Gowan, thank you for coming out today and spending a little time here at the giraffe habitat. All these birds and other animals in here as well. I love this place. But thank you for telling us a little bit about RSV and how you treat it.
My pleasure. It's been a lot of fun.